Our genes tell thousands of stories. Human whole genome sequencing is now a healthcare possibility that can open up the doors for major progress in patient care and planning. The use of genomic data takes medical treatment and proactive healthcare in a more individual direction. Diagnosis of diseases has become more accurate, illnesses are screened in a more targeted way with special attention to people at risk, and research work focuses on the early stages of treatment and how to prevent illnesses and proactively promote good health.
One of the strategic research and development focus areas of Tampere University of Applied Sciences is the utilization of genetic data and big data. We see this as the future of the healthcare services. In our Profitu research, we aim to provide new educational content for the future professionals of healthcare sector.
What kind of ethical questions genomics brings up? How to promote competence of all stakeholders? These are the issues considered in Profitu project. The growth of competence for all stakeholders is very important. It will be obtained through education, but we also need research. Ethical competence rises to a major role in the field of genetics and genomics.
At Tampere University of Applied Sciences, we bring genomic information to the health education of today and tomorrow. We respond to the educational needs with research, degree training, and continuous learning to create innovative skills and new capabilities.
The rapidly increasing knowledge of genetics and genomics has brought a new kind of competence need for healthcare professionals. We will respond to this need with an international master's degree program starting first time in the fall of 2021. In the studies, students have the opportunity to work, for example, in hospitals and companies, and also opportunity to collaborate with research institutes and international research groups.
As a student of health promotion, I'm looking forward to learn how the genomic information is going to change our healthcare system and how to treat patients with the opportunities that genomic information can provide.
Together, we can listen to what our genes are telling us.